Welcome to Speaking Holistically, the podcast that explores the power of alternative medicine, natural healing, and homeopathic solutions to help you achieve true wellness. Each week, Dr. Jen and Amy G dive into the world of holistic health, discussing researched, time-tested remedies with expert insights from Dr. Jen, as well as real-life stories from patients to empower you to take charge of your health. So if you're ready to embrace a more natural path to wellness, let's start speaking holistically, because true healing begins from within. Hi, everybody. Welcome to Speaking Holistically. I'm your co-host, Amy G. I'm here with my amazing co-host, Dr. Jen, and we're doing a Family Health Hub episode today on TMJ.
Yep. So we have plenty of patients that come in and seek chiropractic care for TMD or TMJ. So TMD stands for temporomandibular disorders, and they're basically a group of conditions that cause the joint, the jaw joint or the TMJ, the temporomandibular joint, and the surrounding muscles to have potential issues. So that can include pain, popping or clicking sounds, limited jaw movement, or, a myriad of other symptoms. But the biggest thing is there's actually over 30 different conditions that can be classified as TMJ disorders.
Wow.
Yeah. And what's interesting is because it is right here on both sides, obviously, you can put your finger kind of in the hole and open your mouth and you can feel that joint move.
Yeah.
Sometimes you'll feel it click, pop, move. One side will move more than the other. And this can actually start, it can start in utero, but a lot of times it can start because when the baby is born, there's a lot of pressure being pulled on their head, and their little TMJ joints can't handle that much pressure. Mm-hmm. So that's something that we don't really think about. And if babies have a hard time latching on, it can be caused by that. I've had pediatricians refer newborns to me because they're not latching on properly, and we'll adjust their TMJ and they literally latch on instantly. And no pain, no crying, and they're properly pulling that nipple to the back of their throat like it should be when they're breastfeeding. Obviously, if you're not breastfeeding, it can still play a role into that because they can't latch onto the bottle appropriately, but it definitely makes a difference for mom and baby if there's a breastfeeding relationship there. So it can happen as young as birth, or even some issue, potentially some genetic issue prior to that. So I'm not saying that that's the only reason it happens. Obviously going to a dentist, they have to work on some of your back teeth. They're open, you're open wide. You have a smaller than normal jaw or not. Maybe those muscles are just tight and they had to be open for an hour or half hour, whatever it is. Yeah. It can fatigue those muscles and that joint doesn't basically go back into place like it should. So I see a lot of patients after their dental visits. And I'm not saying, dentists are bad. I'm not saying anything by that at all. You definitely, I don't know how many people love their dentist. It's not something like, yeah, I get to go to the dentist today. Like, it's not generally an awesome experience, but it's definitely a necessary experience for most of us. I do like my dentist. I like their office. I like how they take care of us, but they're also very holistic. And in fact, my dentist doesn't use any Novocaine, and doesn't use any of the anesthesia on me. So just throwing that little bit in there a little bit. So that TMJ basically connects the lower jaw to the skull. So once that joint is disrupted, you can have inflammation that goes up into the cranial muscles, which can be causing headaches and things of that sort. But we don't think about this so much, but it will impact the eustachian tube and how the ears drain properly. So ear infections can ensue, ear aches, sinus issues, all of that stuff, because those eustachian tubes are there to drain the sinuses. So people don't really think about the TMJ creating problems in the whole head, but it absolutely can, down into the neck muscles and everything. So as a chiropractor, I adjust the atlas quite frequently, which is the first cervical vertebra that actually sits right back behind here, which if you measure it, it is this far from the TMJ. Wow. From the joint. So some people think they have TMJ issues. I'll adjust the neck and they're like, oh, my neck, it feels perfect. Or my TMJ feels perfect. And other times once we adjust it, let those muscles relax, or sometimes I literally put on a glove and go inside and release the internal pterygoids on both sides, get those muscles to release, and then we can adjust that TMJ. So I've done that on newborns, I've done it on older people, I've done it on younger people, and it can be from being at the dentist with your jaw open too wide or wrenched on one side. It can be from falls. It can be from getting hit during football, or an elbow to the head or the jaw during basketball, or whatever. Yeah. some of these non-contact sports. So, so if your kid's getting headaches and nobody can figure out why that you're getting headaches or they're getting headaches, it could be coming from the TMJ pulling. And then every time they try to chew, it ends up irritating those muscles even more because it's not lined up like it should be. So stress can play a huge role. I mean, how many times has your dentist asked, well, do you grind your teeth at night? And
That's what I was about to ask. Yeah, grind your teeth. Yeah.
Yeah, I'm like, I don't know, I'm sleeping. Do I grind my teeth at night? I have no idea, I mean, if you chip your teeth, then yeah, I mean, obviously, that's probably happening. Or your spouse says that you're grinding your teeth. So that can play a role into it too, as far as things aren't lining up and it being pulled to one side. So basically, like I said, you can have limited movement. Some people try to open their jaw and it moves a little bit and then they have to get past this point and then it opens more. I've seen that. But like I said, earaches, headaches, ringing in the ears, pain into the head, headaches, jaw down into the neck, that sort of a thing. Some swelling even. My son got his wisdom teeth removed and wouldn't let me adjust him. And he was in visible pain, like couldn't function, couldn't talk for 2 weeks. And I said, listen, I've got to adjust you. And he's like, I can't, because the pain was so bad. So when I was finally able to get to him, his TMJ was just shy of completely dislocated because of whatever they did with him at the oral surgeon's office. And so I go, please, you've got to let me adjust you. So I finally adjusted him and he's like, Mom, the pain is gone, like instantly. I almost cried, but I was so ticked off that he didn't let me adjust him 2 days into it. You know what I mean? I get the first day because he's tender, he's sore. I get that. But I was like, dude, you cannot be this stubborn. I got to get in there. So not just the adjusting, which actually is quite gentle and can be very, very effective. But I use a drop piece at my office. I'll have people lie on their side with the affected side up. And I decide whether it's called open or close. So whether it's going in one direction or the other direction. And then I adjust it in the corrective direction. As the drop table, the piece drops about 1/2 inch and allows me to put more force in that area with less discomfort for the patient. And sometimes they hear it, sometimes they don't, sometimes they feel it on the other side, sometimes they don't. But instantly, people usually look at me with a shocked face and they sit up and they can't believe how much better everything feels. So I do go in there, like I said, with a gloved hand and release those muscles. That is probably the worst part of the whole thing. But it's either that or they're going to keep coming back for the same thing over and over and over again. And I do try to teach patients to go in there with their finger, cut your nails, go in there and release some of those muscles. And I'll show them where they are so they know what they feel like, so they can get in there and do it themselves. Because there are massage therapists that are literally just head and face. And they will know probably more about what's going on than an average massage therapist. And sometimes, depending on the state and stuff like that, they may be able to go inside, but every person can go inside their own mouth to help release those muscles. So obviously there is surgical treatments, and I would not want any kind of scar tissue in that area because that joint is so sensitive to things personally. Mouth guards, a lot of times they do that. I tend to tell people, if you're going to do a mouth guard, come in, get adjusted. Let's make sure your physiology and structure and everything is doing what it should be doing before you go and get that molded into place, so that we're not reinforcing terrible structure and function, right?
Yeah.
The other thing that we do at our office as well is we do dry needling. So we can stick needles into that temporomandibular joint. It's not painful. Most people think, oh my gosh, we're not using these huge gauge needles like you would with like a cortisone shot or something. They're literally acupuncture needles. So, and we use some of the smallest needles for that area, but it can make a gigantic difference. So the adjusting, the muscle release, and the dry needling can make a huge difference. And we did interview Heather, who does, she's a fasciologist, she uses a fascia blaster to do the outside. So you can do the external pterygoids, the internal pterygoids, and massage all of those jaw muscles. And I do give homework really a lot of times where I have them massage in circles, but then also get some sort of like coconut oil or something and massage down the TMJ and down into the mental area. Here's what it's called. So going all the way down. And usually when they do that, they're literally just, because they didn't realize how tender it was. So those muscles will all just keep pulling.
Yeah.
Yeah. So you can do that at home, even without having TMJ, just to keep that released and calm, especially.
I can hear when I open my jaw, on this side, I can hear a faint, it's very quiet, but a little crackle.
So work on those muscles, and then, if you need to be adjusted, get that checked out and see, because a lot of chiropractors know how to adjust the TMJ, but they don't evaluate it unless somebody comes in with actual pain.
And says this is an issue.
Exactly. And so that's the reason they could be having the neck pain, the chronic shoulder pain, whatever it is. So having that checked out is huge. And I've seen getting that TMJ adjusted doesn't allow that to retract at night, and actually can help with sleep apnea.
Oh, wow.
Yeah. So it's all of those structures are all related. So that can make a huge difference in how the tongue is placing and where it's staying at night. So,
Yeah. So what are the main causes? I mean, what are the main things that could cause TMJ for people, just as like a watch out?
well, like I said, a lot of people come to me after seeing the dentist, and they're like, yeah, it hasn't been quite right since, or whatever. And so that's a big one. Obviously, traumas, injuries, whether it's sports, I see it a lot because it's so minor that you got your bell rung a little bit,
Yeah.
that they don't really put it together because it wasn't as significant as they thought it would be for that to happen. Or they're getting headaches, but it's really generally just some sort of a trauma. And it could be clenching, but I tend to find that it's not the clenching that causes it. It's the traumas, the physical traumas that actually occur. And you could have had it since birth. You could have had it when you fell out of a tree when you were 6 years old.
That's so crazy.
Yeah, and hit your jaw on something or your head on something or whatever, and nobody put it together. You bleeding? No, you're fine, get up, go. And now you're 30 years down the road and now you're having symptoms. So, definitely something to take a look at, because people don't tend to put it together. I did work with a dentist actually at this wellness center that was quite well known for anti-aging and stuff in Orange County. And I would go up there and work on his patients that had TMJ. I'd go up there a couple times a month to work on his patients, because he'd have them coming in and making sure that their TMJ was aligned. And it was kind of cool to see all of the different, because I got a big hyper focus of that in those couple hours that I went in there. But it was awesome. So that this dentist was so well educated and aware that some of the stuff that he could be doing could be creating more of an issue somewhere else. And like I said, there's nothing wrong with dentists. I think they can be great, but making sure that you're aware and they're aware, and that they give you an option of, or even tell you like, hey, you might want to go see a chiropractor for this. Like, oh, I don't know why it's happening. We'll just give you a mouth guard. Like, that's not the answer for every person.
Yeah.
And sometimes you can have the best x-rays in the world. The x-rays look fabulous. And they're excruciating pain. And then you have other people who have the worst x-rays, like all this degeneration, all these problems, and their TMJ looks and they have no pain. So what that looks like on film doesn't always equate to what, exactly. It doesn't equate to what they're actually feeling. So that's also something else. So somebody who looks like they're perfectly fine, and now their doctor thinks it's in their head, we know it could be that it's not fully dislocated, but it's subluxated, or it's less than a dislocation, so that it's less, so it's not going to show up on film. It'll look like everything is fine, but you get that adjusted, and I'm telling you, it is night and day, just from personal experience as well.
Yeah. My sister had TMJ once when we were young, and I just remember how bad it was. And she was struggling to eat and open her mouth, and it was just gnarly. It was bad. So you empathize with people when they have this condition, but I don't know how many people even know or think about having a chiropractor adjust it. I don't know how many people are like, oh, I need to go to a chiropractor for this.
So to put it simply, if you have a joint, we can adjust it. And I mean, that's really what it comes down to. And not everybody has we all have the same basic education, but then some chiropractors, just like medical doctors, will go on to do more, to find out more, to adjust differently to whatever it is. So, find somebody who specializes in TMJ, extremity adjusting, stuff like that. So I do adjust the TMJ, I adjust the ears, and that really opens everything up. I mean, people tell me instantly their sinuses are draining. Instantly, like, oh my gosh, I can feel it. So that is, for me, that's kind of the fun part of going to the office and adjusting patients, is that look on their face, that surprise, that, I don't know, I live for that, I think. So that's fun for me, but also watching them heal. And then 2 visits down the road, I'm like, hey, how's your TMJ? And they're like, oh, yeah, no, it's perfect. I hadn't even thought about it. So once they don't have the issue anymore, they're like, oh no, they don't even remember why they came in to begin with. So sometimes pain is the leader. Sometimes pain does get them into the office, but it's really the function that keeps them there. So they get adjusted on a semi-regular basis. And, you know, like I've always said, like, who cares how long you live if you're miserable? So
Yeah. Yeah. And we move our bodies a bazillion times a day. And so things are going to get misaligned. And it's not just if you have an accident and you need an adjustment or something, or, you know, somebody rear-ended you. It's not about that. It's just about how we sleep, how we move our bodies every day, the activities we do. Stuff is going to get out of alignment and need to be adjusted. It's just a fact. So,
well, and then also, like, you know, birth, like we don't realize how traumatic birth is for mom and baby,
yeah.
and how much pressure is actually pulled on the baby's neck and head when they're being born.
Yeah.
So something they're being set up, and if the baby grows into, I mean, when they grow into a child, they just think that that's normal how they feel. Like I had a woman come in one time and she described it, but she didn't really know how to describe it. And after I got done adjusting her, she walked up there, and I always have people do, I call it the walk of shame, but I have them walk down the hall, just kind of get those muscles to integrate and get the central nervous system to do the cross crawl patterning and stuff, just so we can see what else is going on. And she came back, she goes, oh my gosh, I feel so lightheaded. And I'm like, okay, well, explain that a little bit more. And I get that a lot because we're opening up the blood supply to the brain. So they're getting more oxygen, and they're like, holy cow, what is this? So as she started to describe it, we realized that she's basically had a headache her entire life and didn't know that that wasn't normal. She just thought that's how everything felt. So when she started getting adjusted, the headache was gone. And she was like, this is how everybody else feels. So if no one told you, you wouldn't know, right? So the same thing goes with, you know, if you were born and so there was some sort of birth trauma, and even 5 pounds of extra pressure can be too much for certain babies, and doesn't cause neurological damage, doesn't cause physical changes where you can see that. How are you going to know?
Yeah.
So then you become an adult, and then you're having a hard time chewing, and there's popping, and your jaw's hurting. You can't figure out why. Well, it's been out for 40 years. So, you know, what do you expect? Or now you're 70 and you're trying to turn your head in the car to look for traffic, and you can't because there's been stuff going on there since birth and nobody addressed it.
That reminds me of Pete. He told me a long time ago that he has a ringing in his ears, and he has it every day, and he's had it every day his whole life.
Well, we will talk about that on the nicotine patch episode.
Okay.
So that we're going to address on that episode. So we will do that. We'll talk about that.
Yeah, when he told me, I thought, what? I would go insane if there's ringing in my ears 24/7 every day of my life. Like, that sounds like a nightmare. So, and now I'm intrigued that we're
yeah, so get him to the chiropractor and get his TMJ adjusted if it's out, and see what happens, and get his ears adjusted.
Yeah.
And you know, if he has chronic sinus issues, then work on that. There's a lot of different techniques which we will talk about. There's one called nasal specific, which we'll get into a little bit more too. And but sometimes the nicotine patches, and they are not addictive, will help with binding to the nicotinamide receptors, and it can help. I've had a lot of patients helped with tinnitus with nicotine patches.
God, that's so trippy. I would never have put that together. Oh my God.
Just wait. There's so much more to talk about.
Well, thank you, Dr. Jed. This was a very interesting episode. And I feel like, yeah, now I'm even more. I can't wait till the next one, because now I'm thinking about the ring in the ears. But yeah, this was great. Wow. Thanks everybody for listening. If you haven't joined our school community before, I'll put the link in the show notes below. You can also follow us on Facebook, Instagram, or subscribe to our YouTube channel. Till next time, everybody. Bye-bye.
That wraps up another episode of Speaking Holistically. Thank you for listening. We hope today's conversation gave you new insights and inspiration to take charge of your health. If you enjoyed this episode and want to hear more, be sure and join the Speaking Holistically school community by clicking the link in the show notes. There, you'll get access to daily podcast episodes, weekly live Q&As, educational content, and so much more. You can also connect with us on our Facebook page, follow us on Instagram, and subscribe to our YouTube channel. Until next time, be well, stay curious, and keep speaking holistically.